Good morning. My name is Michelle Stevens. I'm the Public Health Director. I'm here with Dr. Terry Frankovich, our County Health Officer, as well as Humboldt County Sheriff William Hansel over here, and Humboldt Bay Fire Chief Sean Robertson, and Brian Derby, who's the Office of Emergency Services Manager. Thank you all for being here. Let's get started.
Good morning. As probably everyone here knows, the current COVID-19 outbreak began in late December in Wuhan, China. As of last evening, there are over 100,000 cases of this infection across the world and 647 in the U.S., with 25 deaths. California alone has had 133 cases, and that number actually has been upticked today. In Humboldt County, we have had one confirmed case. We are now seeing community transmission in many areas of the United States and in California. Although there is currently no evidence of local community transmission in our county, it will most certainly occur. In light of this, today, as the health officer of Humboldt County, I'm declaring a local health emergency in response to the COVID-19 outbreak. I want to reassure area residents that there has been no significant change in our local situation. However, this is an important proactive next step as we observe what is happening across California and the rest of the country. This declaration will allow us to access additional resources locally and facilitate coordination at the local, state, and federal level. It will fundamentally enhance our ability to accelerate preparedness activities and react quickly to anticipated increases in local COVID activity. We know that as testing and the number of cases increase over the coming weeks or months, there will be more demands on public health and its array of community partners who are integral to a vigorous community response. Those include hospitals, clinics, EMS, law enforcement, many others. This declaration will also allow for the possible federal reimbursement of expenses tied to these efforts, including support for the Humboldt County Public Lab, which has begun limited local and regional testing for the virus. As more reagents needed for testing arrive, capacity will increase. This is an exciting new development in our ability to respond to the outbreak locally. Healthcare providers seeing their patients will now be able to make a decision about the need for testing, collect specimens, and submit them to the public health lab or to a commercial lab for testing, as these labs have come on board. It is important to note that public health is not directly collecting specimens from patients for testing. The decision about whether to test and the collection of specimen rests with primary care and hospital-based providers at this time. Bottom line, COVID-19 planning and response requires a robust community-wide effort. The local public health emergency sets the stage for the continued and expanded work that must be done as we move forward. Thank you.
And with that, we'll open it up for questions.
I have a question. Are you guys still working to get test kits here locally? I remember last time we talked, you were saying that would be a huge help because right now you're still sending it to the CDC and you said commercial labs. Can you elaborate on that?
Right. So our lab here now has received kits to be able to test. There's certain components that we need additional supplies of. We are able to run testing right now, but we still have a limited capacity in terms of the number of tests because of having those additional reagents on hand. The commercial labs are a huge asset, and it simplifies the process in some ways for the primary care providers as well. And basically what it does is it increases our capacity to test. Mm-hmm. Yeah.
Some communities have limited the size of public gatherings and
Mm-hmm.
stuff like that as a preventative measure.
Mm-hmm.
San Francisco just caps public gatherings of 1,000 people. Is that
Mm-hmm.
something that's you think would be warranted in Humboldt County or is being discussed?
Well, I think there's some great guidance coming out now from both the CDC and the state about mass events. And if you look at those directions or guidances that are given, they really suggest tiering your response in terms of events to what's happening in your community. So right now, in the absence of documented community transmission, there's really no recommendation to just cancel events. The recommendation really is to use enhanced safety at those events. So, doing things as we've been talking about, making sanitizer available, encouraging hand washing, distancing where you can do it, encouraging people strongly to not attend when they're ill. Those are things that are really good first passes, as well as, cleaning and all of those other things that can happen. When we have evidence of community transmission, that's when you start ratcheting up those types of moves to increase your mitigation and impact of the number of cases in the community. We could be in this for a long haul, and we want to be sure that when we put in place things that may limit our social interaction, have implications for families who are working, all of those things, we want to be sure we're doing it at the appropriate time.
Then I know you said about bringing more test kits here locally. So if people believe that they have it, can they ask to be tested, or is it a medical professional that has to be the one that says, okay, let's test them?
Really, in any case, it needs to be a medical professional who is evaluating the patient and the need for testing. Absolutely.
So someone can't just walk into the emergency room and say, hi, I showed these symptoms, can I be tested?
Correct. And in fact, we are still encouraging, because we're not seeing local circulation, that people call in advance, make sure healthcare entities are aware of their concerns so they can be prepared.
So the large events, some people, some organizations in the community are already starting to cancel their live events. Would you tell them that that's premature, that that's it's not necessary at this time?
You know, my response is I understand the concern. I completely get it. And I think that people are trying to figure out as they go the best response. I would tell you that from a public health standpoint, we're certainly not mandating that. And if any organization, of course, can choose to restructure and postpone or do things differently if they choose.
Some are also doing that in consultation with public health, and that's the message that we're saying as well. You know, there is CDC guidance around that. The document that she was referring to that just came out has a tiered level system, and so it really, the feedback that we're getting is that folks find it helpful.
How many people have been tested, and how many people are being monitored?
Well, we have in our area, we have either sent away or conducted a total of, we've 11 different individuals. We have, other than our initial case, we have no additional positives.
And are any other people being monitored?
We're not commenting on monitoring numbers.
Of those 11, were any of them exhibiting symptoms, or is it just that they had been in proximity with the confirmed case?
Those were not all in connection to the initial case. They were other individuals where providers may have had concerns about whether it could have represented infection, so those individuals were tested.
I assume that OES is planning right now for like various scenarios. Yeah, there's I think everyone's seen the chart going around where without public health measures, the goes like this and overwhelms our capacity.
The pandemic curve.
Yeah. So can you share anything about what OES is specifically doing at this moment? Like what sort of measures are being taken? What sort of are being envisioned if the curve goes above capacity?
Well, what I can tell you is just the first steps along with this declaration today is really establishing a joint information center that is very nicely being hosted by the Sheriff's Department in their setting so that we're able to get more information out to people as they need it. It allows us to be much more active about both answering phone calls with concerns in various areas, business, faith-based communities, schools. And then basically also pushing more and more of that information out into the community. I think we've been trying to message a lot of the sort of prevention techniques that are appropriate for right now, but we also want people to be prepared going forward for next steps that they might be needing to take. So that's kind of where we're focusing right now. Obviously, underneath all of this is ongoing planning for contingencies. So preparing ourselves for the event of when we start to see maybe 1 to 5 cases of community transmission. What happens when we start to see more cases and we're seeing an impact on healthcare system? So all of that planning is happening. I don't know if the sheriff would like to speak to OES in particular.
Yeah, so with the declaration of emergency through public health, we have established that we operated our Office of Emergency Services starting at 8 a.m. this morning. And so Ryan Derby, my manager of OES, has staffed our OES facility, and with that comes a lot of avenues now that we work with the state and the federal government. And so part of those avenues, like you said, Hank, is planning. Planning's definitely a part of that. Planning logistics, also tracking finances. And so we're in a support role for public health to make sure that they can focus on this emergency and that we can support them in their role throughout this whole process, because they also have their day-to-day operations to run, right, as well as this emergency. And so as a county as a whole, working with fire and medical, we are doing our best to make sure that we are out in front of everything we possibly can to be out in front of. So part of that definitely is planning and thinking about contingencies.
And so, I mean, can you describe a little bit of the, say, the contingency is the worst case scenario? What sort of, or the best case scenario?
Right.
What sort of things are you looking at specifically?
One is our current capacity. What is our current capacity with treatment, with dealing with this, not only for the patients and our taxes on the medical facilities and those kind of things, but also our government's capacity. And we have to also prepare for what happens when our community and government services start declining because our own people are sick. And so there's a lot of things that are going into that planning. One is preparation, giving people the essential information that's necessary so they know when to call in sick, when not to come to work, and also prepare to make sure that our continuity of government, continuity of operations is flawless through this whole process. So by opening up our OES, we're able to plan that and start going through those check boxes to make sure that we can still deliver all of our services.
I think the other thing is the sort of the community mitigation that we were talking about, and I think you had asked about, is just that idea of ratcheting up the response depending on what's going on in the community. So are we talking about closing schools now? No. Are we looking at the possibility of that down the future and what would trigger that? Absolutely. And are in conversations with the schools about those things. What are we going to be doing about mass events? And what will trigger that next step? So that's all part of pandemic planning, basically. And so we'll be talking more and more about that within the community and to all of our partners as well. But those have been ongoing conversations amidst a lot of these entities in the community already. And a lot of those conversations started around pandemic flu planning. Yeah.
We've seen that this virus is obviously most impactful and most deadly with vulnerable populations, like the elderly, the infirm, and particularly so in close living quarters. So I'm curious if public health is doing anything to proactively reach out to skilled nursing facilities, nursing homes.
Sure.
Things like that.
Yeah.
There's protocols in place in that area.
You're absolutely right. I mean, that is what we know so far about this virus is it appears that young people do very well, children in particular do very well, and that the bigger burden of serious disease seems to be on older individuals and individuals with underlying health conditions. Skilled nursing facilities are a huge focus of importance. And so we've been having conversations with those, actually doing some of that regionally as well, to look at, again, those contingency plans. What do they have in place right now in terms of active monitoring for visitors, for staff, enhanced cleaning, all of those measures, as well as looking at what would be trigger points for things like closing to visitors, which is obviously a huge impact on both the residents and their families, and not something you do lightly. And so we want to be sure when we make that move, if we do need to make that move, we do it at the right time to make it as seamless for families as possible. Anyone else?
It seemed like there might have been some people locally who were on that cruise ship that, I guess, that was quarantined. So is there some plan for like people like that or people who have been traveling when they come back into the county? How is that kind of handled? What's the protocol for that?
Sure. So, I mean, there are a couple different groups. For those CDC level 3 alert areas that we've talked about in the past, and those are going to be changing, I'm sure. But, talking about Iran, Italy, Japan, South Korea, those areas, the recommendations we've been, I think, very clear putting out, and people have been getting direction from CDC as well, that those individuals should be self-monitoring and limiting their activities upon their return until they're 14 days out from their return. Cruise ship individuals has been an interesting evolving situation, and you're right. We've been in conversations with the state about the disposition of passengers with that cruise, and what will be happening is we'll be notified of individuals in our area who may be on that, and then understanding what the planning is for any return to the community. So public health will be involved in that process.
But has not been notified yet.
Of any passengers, no, we have not. So I think they've been managing on the ship right now and sort of organizing the response to that. And as people are screened, as they're asymptomatic and perhaps able to leave that ship, we'll be notified about where they're going.
Will you only be notified if they're symptomatic?
We'll
Or if
be,
they- So like if they've been tested, or if they haven't been tested, rather?
we'll be notified, as I understand it, about passengers from this area who are on that ship, or for whom this was their final destination, or, next destination. Anything else?
From a public health standpoint, what would you tell people who say Humboldt County is unprepared for a situation like this?
Well, I think people are reasonably concerned about what's going on, and I get that. And I think in communities across the country, there are people worried about that. And I think what I would say is that, again, planning for this sort of thing began with pandemic flu planning. This is not much different from that situation. And so when you think about our healthcare entities and such, as well as public health, a lot of these contingencies have already been looked at and plans put in place for response. What we're really looking at now are sort of the nuances and the updated sort of guidances that come through around coronavirus specifically. And so I think people should be reassured that there's a high level of work and monitoring going on around this issue. And I think there are a lot of things families can do at home to sort of plan for this as well. And again, we'll be emphasizing that as we go. But I think people should be assured. And I think the declaration and giving us this additional ability to collaborate and pull in resources is also going to be really helpful as we respond. Anything else? Thanks, everyone.
Thanks for being here.